Good afternoon, everyone. My name is Maram El Jilani, and my student ID number is 2214091. Did you know that in Australia, a stroke happens every 19 minutes, and 1 in 4 people will experience a stroke at some point in their life? This presentation will focus on Mrs. Teresa Manalo, who has suffered an embolic stroke. Mrs. Manalo entered the ward with dizziness, palpitations, and general unwellness before doctors discovered her decreased level of consciousness, slurred speech, and left-sided weakness. An embolic stroke happens when a blood clot originates elsewhere in the body, usually in the heart during atrial fibrillation, and travels to the brain, obstructing a cerebral artery. This sudden reduction of blood supply causes neurological impairments and requires immediate assessment and treatment. In this presentation, I will just discuss three key areas. The ATE assessment approach for Mrs. Manala, integrating her vital signs and clinical reasoning. 4 high-priority nursing interventions to manage her embolic stroke. And the nursing considerations when administering 3 of her prescribed medications. The ATE assessment helps healthcare providers identify emergency situations and determine treatment order in acute stroke care through its structured evaluation process. The patient maintained a patent airway while receiving oxygen through a Hudson mask at 6 liters per minute. The patient's GCS score of 12 indicates a high risk of airway obstruction and aspiration because she has an impaired gag reflex. The nurse needs to maintain airway patency while having suction equipment ready and being prepared to increase the level the level of care if any problems occur. The Acute Stroke Clinical Care Standard from the Australian Commission on Safety and Quality in Healthcare 2019 emphasizes immediate airway protection assessment for suspected stroke patients. Breathing. The patient took 26 breaths per minute that were shallow but equal bilaterally while maintaining 95% on oxygen saturation levels. The patient shows tachypnea, which could result from 2 possible causes: her brain needing more oxygen or her heart condition leading to pulmonary congestion. The patient needs oxygen saturation monitoring above 95% while being placed in a semi-powerless position to enhance breathing and decrease the risk of aspiration. Circulation. The patient exhibited a heart rate of 132 breaths per minute with rapid atrial fibrillation and blood pressure readings of 170/95. The brain uses autoregulation to preserve blood flow through the brain after an embolic blockage, which results in elevated blood pressure. The nurse needs to monitor the patient's heart rhythm closely while avoiding rapid blood pressure reduction unless preparing for thrombolytic surgery or therapy. The Stroke Clinical Care Standard requires patients to have systolic blood pressure levels below 185 when receiving alteplase. Disability. The patient scored 12 points on the GCS, which shows she has a moderate level of consciousness impairment. The patient displayed slurred speech, left facial weakness, and left-sided paralysis, which indicated a right middle cerebral artery infarct. The nurse needs to check the patient's neurological observations through limb strength tests, pupil size, and GCS evaluations at least once per hour to help identify any worsening condition. A 2-point decrease in GCS score requires immediate activation of the rapid response system. The patient needs glucose levels between 5 to 10 to prevent neuronal damage from hypoglycemia. Exposure. The patient had no fever and no open wounds while receiving Hartmann solution at 20 ml per hour. The patient needs to stay at normal body temperature because elevated body temperature increases brain activity and produces negative results in treatment. The nurse needs to check the patient's skin condition and perform 2 hourly turns and provide appropriate pressure area care to stop injuries from forming. The ATE assessment provides healthcare professionals with a complete evidence-based method to determine essential care needs and make clinical choices, and also protect patients during acute stroke treatment. Question 2 focuses on the 4 high priority nursing interventions. So, firstly, the patient requires ongoing care to preserve her airway and to ensure optimal oxygen optimal oxygenation levels. The patient is also at increased risk of aspiration due to her diminished consciousness and compromised facial muscles. To protect her brain from hypoxic harm, the patient is given oxygen therapy while in semi-paralysis position, as well as suctioning procedures such as suctioning procedures as needed. Secondly, the patient requires regular neurological checks to monitor her condition. The patient requires GCS monitoring, limb strength, and pupil assessment every hour to identify early signs of thrombosis, complications such as hemorrhagic transformation and deterioration. Early detection enables rapid escalation and is consistent with the stroke unit standard of care. Thirdly, the healthcare team must establish appropriate body positioning and implement pressure area care strategies. The correct body positioning helps blood flow drainage while lowering the brain's pressure and prevents the affected shoulder from slipping out of place. The practice of turning patients every 2 hours protects their skin from damage while preventing pressure injuries that affect immobile stroke patients. Fourthly, the healthcare system needs to prepare for post-thrombolytic therapy. The nursing staff needs to verify no intracranial bleeding exists prior to IV alteplase administration, while also checking vital signs and maintaining blood pressure at 185/110 or lower. The patient requires ongoing observation for bleeding and neurological deterioration after IV alteplase administration, according to time-sensitive treatment protocols. These interventions work together to maintain neurological stability while ensuring proper perfusion and preventing complications which present fundamental elements of acute stroke nursing care. Okay, the following section examines 3 essential medications which Mrs. Manalo receives as a part of her treatment plan, including IV alteplase, heparin infusion, and metoprolol. So, the patient requires confirmation of stroke through CT scans, and the symptoms started less than 4.5 hours ago. There are no signs of bleeding. The patient needs to receive baseline blood pressure and coagulation test results before treatment. The treatment requires a 0.9 milligram dose, not exceeding 90 milligrams, which should be given as a 10% bolus injection followed by 1 hour infusion. The patient should avoid all invasive medical procedures throughout the 24 hours following the infusion. The medication causes intracranial hemorrhage, hypertension, and angioedema as its main adverse effects. The patient requires neurosign checks every 15 minutes for 2 hours, followed by checks every 30 minutes for 6 hours, and then hourly checks. The infusion needs to stop right away when the patient shows any sign of neurological deterioration. The administration of alteplase within the therapeutic window leads to better cerebral reperfusion and improved patient results. Yep. The patient needs APTT testing along with pellet count and assess any signs of bleeding before commencing treatment. The administration of heparin becomes unsafe when patients have undergone recent surgical procedures or show any active signs of bleeding. The infusion pump delivers the medication through a dedicated IV line. The patient needs APTT testing every 4 to 6 hours, as well as dose adjustments according to established protocols. The patient requires a dedicated IV line for this treatment. The medication may cause bleeding, bruising, and heparin intrusion as its main side effects. The nurse must watch for bleeding gums, epistaxis, and blood in urine or stools while implementing bleeding precautions and verifying medication dosage with another registered nurse. The patient must receive their medication after the healthcare provider checks the heart rate and blood pressure levels for this medication. The medication should be withheld from patients who have heart rates below 50 beats per minute or systolic blood pressure levels below 100. The patient needs to take the medication with food, and the healthcare provider must avoid stopping the treatment abruptly. Patients may experience bradycardia, hypertension, dizziness, fatigue, and bronchospasm as the primary side effects of this medication. The patient requires ongoing ECG monitoring for AF management, as well as monitoring for side effects and educating them on adherence and slow position changes to avoid postural hypertension. The administration of metoprolol helps control heart rate and decrease cardiac workload, which prevents new blood clots from forming. So, in conclusion, the embolic stroke that Mrs. Teresa Manalo suffered from atrial fibrillation, which produced a cerebral embolus that caused right-sided brain tissue damage. The ATE assessment led me to prioritize airway management, perfusion, and neurological stability. Airway protection, neurological assessments and placement, and thrombolytic treatment preparations are the 4 critical nursing interventions for stroke care. They maintain oxygenation and cerebral blood flow and prevent any further complications. The administration of alteplase, heparin, and metoprolol requires nurses to perform thorough assessments, exact medication delivery, and ongoing patient monitoring for safe and effective treatment. The Acute Stroke Clinical Care Standard 2019, along with other supporting literature, enables nurses to deliver evidence-based practice, structured care that promotes the best possible recovery outcomes for patients while also maintaining their safety. Here are the references I have used for this, and thank you so much for listening.